So, what are we going to look at and where did all this come from? Well, global public health really started with cholera, going back over 100 years now, going back a few hundred years. We were starting to have quite a lot of maritime activity. We're seeing quite a lot of movement of humans around the world, and this was particularly movement of humans around Europe, and then they started venturing from Europe out towards the Far East and ultimately the Americas. Any boat travel that we had was occurring at a time in which we had very little in the way of public health or healthcare infrastructure. There's very little known about disease, and this was at a time in which we still had the miasma theory of disease, where they believed that it was associated with bad smells and bad air. And the sort of right with some pathogens, but they really didn't understand how germs worked and what germs were, and certainly had no knowledge of viruses. And so people were still practicing healthcare solutions such as bleeding people, where they'd try to remove some of what they thought was the bad blood in people's system. And there were some herbal remedies being used, which had very mixed levels of effectiveness. And so the doctor's profession was self-financed, and it didn't have this awesome reputation that it has today. The doctors or herbalists were seen as being just another profession that sold things to people the same as anything else, whereas people would rely on doctors. Very often the sort of healthcare that was carried out was not very effective. And so when they got an outbreak of a transmissible pathogen, then one of the things that happened was it very often affected not just the poor but also the wealthy, and cholera was a particular problem for this. Because it was waterborne, it could be picked up very easily by both the rich and the poor, and it tended to follow trade routes as the cholera victims moved around from location to location. And so we started to see the first introduction of quarantine rules to stop it. People broadly worked out that if they stopped the movement of people from locations where there was cholera to places where there wasn't cholera, then the cholera epidemic tended to be stopped as well. But people lived in absolute terror of it, in particular cholera, because you could catch it in the morning and be dead by evening from loss of liquids from your body. Bear in mind that if you're treating cholera in these locations, if you take a look at the photo just above the victims of cholera are not in a sort of sterile environment with linen that can be removed and replaced and readily washed. All of the bed linen there is very expensive, and it was washed only by people that you really trusted, and a lot of people would not have had proper bed linen, and so there'd been no running water present. There'd have been little in the way of soaps to effectively cleanse hands. People didn't know about boiling water, and so what happens is if the cholera victim is then often looked after by their family and people close to them, and so they produce an awful lot of infected fluids as they come down with cholera, and so as a result those infected fluids then got into contact with their immediate family, and so very quickly the cholera would spread to the whole family, and so people could have cholera in the morning and be dead by evening. And so they used quarantine rules to stop it. And so in 1851, 12 EU governments actually met to give, or when I say governments, it's very often the peer of the realm, the king or queens, met to give consistent use on quarantines. Unfortunately, this was very unsuccessful, as we've seen in modern healthcare, modern epidemics. The politics very often and commercial interests very often got in the way of the public health aspects of these quarantines, and so the there were two main problems with this. One is that if another country was producing something at a cheaper rate than your country, or vested interest in your country wanted to stop imports coming in, then they could very easily use quarantine rules to introduce those imports and then to frustrate trade between the countries. And another problem that you got was that if people were seen to be suffering and they were put into quarantine, then it was not something that was diagnosed by the medical practitioner necessarily. It may just be someone that was picked up by the constabulary, the police in the port area. And they'd take you, if they thought you were suffering, or someone said you were suffering from some form of disease, and they'd cart you straight off to a hospital or a quarantine centre. And so this would normally be filled with people that were suffering from some form of infectious disease. So if you didn't have the infectious disease before you went in there, you certainly had it by the time you'd been in there for a short period. So ultimately it became a self-fulfilling prophecy, because the people that put you into this quarantine environment were ultimately always right, because you always ended up with the disease, but you may not necessarily have had it in the first place. In the 1890s, they had some rather better regulations which were agreed internationally for public health at ports, still based around quarantining of areas and some of these rather disagreeable practices, but they kept on having to draw it back to the public health aspects and take it away from the commercial business and the political aspects. Eventually, the USA formed the International Sanitary Bureau, and the EU formed the International Office for Public Hygiene to try to coordinate some of the international public health efforts. But public health internationally was still very much in its infancy.